In the name of Allah, the most merciful and most beneficent, I'm thankful to the organizers of this event for International Nursing Webinar with the theme of family-based care for chronically illness. I'm Professor Dr. Saeed Ahmed Gilani, and I'm working as Professor of Radiology in the Department of Medical Imaging at University of Sharjah in United Arab Emirates. My topic today is the role of medical imaging in family-based nursing care for chronic illness. How we define chronic illness and family dynamics. The chronic illness represents one of the most significant healthcare challenges in developed world, especially in the United Kingdom today, with approximately 1 in 3 families directly affected by conditions that persist for years or even decades. These long-term health challenges do not exist in isolation. They fundamentally reshape family structures, routines, and relationships, requiring a comprehensive approach to care that extends beyond the individual patient. So the ripple effects of chronic illness extend to every family member, altering daily routines, emotional well-beings, and financial stability. How we define a family-based nursing care, a unified approach. A family-based nursing care treats the patient and family as an inseparate unit rather than focusing solely on the individual with a diagnosis. So, family based nursing care means you are caring the family as a unit. You are not focusing on individual diagnoses or individual treatments. So, it is a unified approach. Then is collaborative partnership. Nurses work alongside families, recognizing them as essential partner in care rather than passive recipients of instructions. Holistic perspective. This approach addresses physical symptoms whilst simultaneously supporting emotional, social, and practical needs of the entire family system. So the family-based model represents a significant shift from traditional patient-centric approaches, acknowledging that chronic illness management happens primarily in home environments. Now the question arises that why family care matters in chronic illness. The first thing is role transformation. The chronic illness often necessitates dramatic shifts in family roles, with spouses, children, or parents assuming caregiver responsibilities alongside their existing roles. The second thing is improved outcomes. If we talk about the improved outcomes, we can see that research demonstrates that effective family support correlates with reduced hospitalization rates, better medication adherence, and improved quality of life by yes. Third important thing for family care in chronic illness is the emotional well-being. So emotional well-being is very important because the comprehensive family support reduces anxiety, depression, and feeling of isolation for both patients and caregivers. Then comes the psychological impact on families, which is a hidden burden on families which are involved. So, UK studies reveal concerning statistics about the mental health of family caregivers. 40 to 70% of primary caregivers show clinically significant symptoms of depression. 25 to 50% meet diagnostic criteria for major depression, and post-traumatic stress symptoms are reported in up to 40% of parents caring for children with chronic conditions. Anxiety disorders often approximately 30% of spousal caregivers. So the nursing intervention is required, which is family-based nursing, which addresses these challenges. Now we come to the overview of medical imaging in chronic disease. The most commonly used modalities of medical imaging includes magnetic resonance imaging, which is MRI, computed tomography, which is CT, medical diagnostic ultrasound, and X-rays. MRI, as we know, provides detailed soft tissue visualization without radiations, critical for neurological conditions, musculoskeletal disorders, and cancer staging. CT, which is computed tomography, offers cross-sectional views of the body, essential for monitoring lung disease, abdominal conditions, and vascular complications. Ultrasound is a non-invasive, radiation-free imaging ideal for cardiovascular assessment, abdominal conditions, and pregnancy monitoring in chronic illness. Whereas X-rays is the fundamental for monitoring bone health, joint disease progression, and chest conditions like COPD and pulmonary fibrosis. There is imaging-driven care pathway. So the medical imaging serves as a critical decision point in chronic illness management, with studies showing that imaging results directly influence treatment modifications in more than 70% of cases. The visual evidence provided by imaging enables early detection and disease progression before symptoms manifest. Prompt identification of complications require intervention. So if we have imaging modalities, we can have early detection of disease progression before the symptoms appear or they manifest. The prompt identification of complications requiring intervention and objective measurement of treatment efficacy. Precise guidance for intervention procedure is also possible with the help of medical imaging modalities like CT, MR, angiography, ultrasound, fluoroscopy, etc. So I can say that timely imaging allows us to detect complications months before they would become clinically apparent, providing a critical window of intervention that can dramatically alter disease trajectory. Very important thing to be discussed with the students of nursing and our colleagues who are in this profession of nursing. The imaging nurse role is, I can say, a hidden gem. They can provide clinical guardianship. Then is the continuity champion and comfort providers. If we talk about the guardianship, I mean the clinical guardianship, the imaging nurses ensure patient safety through comprehensive assessment, monitoring during procedures, and management of contrast media and radiation exposure risks. Continuity champion means they maintain the thread of care across the multiple imaging episodes, updating care plans and communicating findings to the broader healthcare team and family. When we talk about the role of imaging nurse as comfort provider, we can say that through expert positioning, anxiety management, and procedural support, imaging nurses transform potentially frightening experiences into manageable healthcare interactions. Collaboration with the healthcare team. There is a collaboration between the imaging nurse, radiologist, radiographers, sonographers or technologists, primary care team, and family unit. So these are the five integral parts of the team which collaborate to support the chronically ill patients. Let's discuss how the imaging nurse plays his or her role. The imaging nurse serves as the primary liaison between family, patient, and imaging team, coordinating care and providing continuity across multiple visits. The radiologists, they interpret images and generate reports. Nurses translate these findings into practical information for the families. The radiographers, sonographers, or technologists operates imaging equipment. Nurses prepare patients and families for what to expect during the technical aspect of procedures. The primary care team, referring clinicians who integrate imaging findings into the broader care plan. Nurses ensure communication flows seamlessly. And the last but not the least is the family unit. They activate the activity or participation in the imaging process, requiring education, support, and involvement in decision making. The workflow imaging in chronic care, the first thing is the pre imaging. Nurse-led scheduling and prioritization, family preparation and education, safety screening and risk assessment, medication management, that is metformin suspension before contrast is one of the example, that before giving contrast they stop the medication of some diseases, uh, especially in diabetes. They stop the metformin as it can interact and have complexities or complications or reactions if drugs like metformin are given before the contrast. So we have to avoid such drugs which can interact with the contrast if the contrast is being given, especially with CT and MR. So these are the requirements for pre-imaging. Then during imaging, patient positioning and comfort measures are important. Anxiety management and procedural support, monitoring for adverse reactions, and documentation of procedure details. These are done by the imaging nurse. The third step is post-imaging, immediate aftercare and monitoring, preliminary findings, discussion with family, care plan update based on results, and scheduling follow-up appointments. The long-term integration results incorporate into chronic care pathway, family education on implications, coordination with primary care team, and documentation for longitudinal comparison. So these are the 4 steps in workflow while having imaging in chronic care. Example for imaging support in diabetes care. Patient can have vascular complications because of the diabetes and retinal complications, eye complications, which is done by retinal monitoring. The duplex ultrasound, which is color Doppler ultrasound imaging, is essential for monitoring peripheral vascular health in diabetic patients. Imaging nurses play a crucial role in explaining the connection between glucose control and vascular health, teaching families to recognize early warning signs requiring urgent imaging, demonstrating how imaging guided intervention can prevent limb loss because of any gangrene, which results because of the complications of diabetes, ensuring regular attendance at screening appointments, educating family on the importance of blood pressure control in preserving the vision of the patient, and coordinating prompt intervention when imaging reveals retinal changes. The UK's diabetic retinopathy screening program has reduced diabetes-related blindness by 70% through regular retinal imaging. So the nursing unit, which is especially the imaging nurses, they spotted it, and there is a vital role of imaging nurses in this reduction, which is 70% in UK. Let's discuss a case study in which the cancer and family nursing with imaging were involved. The case was patient name was Elizabeth, 58 years, diagnosed with hepatocellular carcinoma, unsuitable for surgical resection. So the surgery was not possible, was not fit for it, was 58 years female having hepatocellular carcinoma. So the steps taken were the pre-procedure family consultation. The imaging nurse, Sarah, conducted a detailed session with Elizabeth and her daughter, explaining the upcoming interventional radiology procedure using anatomical models and previous scan images. So we have just given the names. These are not the real names, just for this example, I have put these names. Then, after pre-procedure family consultation, the interventional procedure took place. Sarah remained with Elizabeth, so the imaging nurse remained with the patient during CT guided radiofrequency ablation, providing reassurance while monitoring vital signs. Her daughter waited nearby with regular updates. Then, post procedure support, Sarah showed Elizabeth with her daughter the intra-procedural images, explaining what had been achieved and what to expect during recovery at time. 3 months later, Sarah welcomed the family back for follow-up MRI, celebrating with them when images showed successful tumor ablation with no recurrence. So there was role of imaging nurse in pre-procedure family consultation, interventional procedures, post-procedure support, and follow-up imaging. So everywhere there is a role of a family nurse or an imaging nurse in this example, in this scenario. Innovations or imaging for neurological diseases. The nursing role in advanced neuroimaging therapies includes the patient selection and family preparation for multi-hour procedures, continuous monitoring during treatments that may last 3 to 4 hours in the MRI scanner, real-time assessment of symptoms, improvement during procedure, post-procedure family education on expected outcomes and home management, and coordination of follow-up imaging schedule to track long-term efficacy. So high-intensity focused ultrasound, which is HIFU, represents a revolutionary approach to treating Parkinson's tremors, combining real-time MRI guidance with precisely targeted ultrasound energy. So these procedures require specialized nursing skills at the intersection of imaging expertise and neurological care, with nurses often becoming the primary advocates for patients during these intensive treatments. After neurological problems, let's see the imaging in cardiac chronic illness. So the first step in such cases will be the diagnostic phase, Then is the treatment planning, monitoring phase, and end stage management. When we talk about the diagnostic phase, the initial echocardiography is done. We can perform the echocardiogram and cardiac MRI, which establish baseline function and structure, while imaging nurses provide detailed explanation of findings to both patient and families. The treatment planning. For treatment planning, the advanced imaging guides interventional decisions with nurses facilitating family consultation, where cardiologists use visual aids to explain planned procedures. Monitoring phase is also very important. Regular follow-ups, imaging track disease progression or treatment response with nurses ensuring family understandings about the significance of subtle changes in cardiac function or cardiac dimensions. The end stage management includes the imaging, which helps determine timing for advanced intervention like VAD or transplant, with nurses supporting families through difficult decisions informed by imaging findings. There is family engagement with imaging results. So, nurse acts as an interpreter. Radiological reports often containing complex terminology that can overwhelm families. Imaging nurses serve as translators, helping families understand the significance of change from previous studies, the relationship between images and symptoms, implications for treatment modifications, and expected progression based on imaging findings. So, when the families comprehend imaging results, the self management behavior shows measurable improvement, family anxiety decreases as uncertainty, medication adherence improves by up to 60%, and attendance at follow-up appointments increases 40% by 40%. So there are benefits which are of visual understanding when families comprehend imaging results. Then comes how we reduce the family uncertainty about imaging, especially during the imaging. So pre-imaging education. The imaging nurse provides comprehensive explanation about MRI safety and contraindications, radiation exposure risk in CT and X-ray, contrast media use and potential reactions, and procedural details and duration expectations. Pediatric considerations. Special approaches for children include age appropriate preparations using toys and models, parents, parent coaching for supporting anxious children, distraction techniques during procedure, and child-friendly environment adaptation. For anxiety management, for anxious patients of all age, guided imagery and relaxation techniques are used. Familiarization visits to imaging departments, clear communication throughout procedures, and family presence when safe and appropriate. Addressing safety in imaging. In UK and European Union safety standards, the British imaging departments operate under strict safety guidelines governing radiation exposure limits to patients and the caregivers, MRI safety zones, and screening protocols, contrast media administration and monitoring, infection control during interventional procedures. So the nurses serve as primary enforcers of these standards, ensuring compliance with medicines and healthcare products. Regulatory agency and European Society of Radiology guidelines are used. Now, while having safety in imaging, there are some responsibilities of the nurses, like the key safety function performed by imaging nurses include comprehensive safety screening of patients and accompanying family members, obtaining informed consent after thorough implementing timeout procedure before interventional imaging. Then is the continuous monitoring during and after immediate response to adverse events or reactions, especially when there are contrast administration, knowing the risk, and they can also discuss the risk factors before the procedure so that the risks can be minimized. Then is the managing complex cases, imaging and family-centered care. We have a case example for stroke rehabilitation with multimodal imaging. In acute phase, the initial CT and MRI scan establish stroke location and extent. Imaging nurse support distressed families through this critical diagnostic phase, explaining findings and their implications. Then is early recovery phase. The functional MRI identifies viable brain tissues and potential for recovery. Nurses use these images to help families understand rehabilitation goals and set realistic expectations. Then is the rehabilitation planning. The DTI tractography maps neural pathways for targeted therapy. Imaging nurses collaborate with the physiotherapists to translate these findings into family training sessions. Long-term management includes the perfusion studies, guide ongoing risk management. Nurses educate families in lifestyle modification based on visualized vascular healthcare changes. In chronic respiratory illness, imaging and home care planning. The COPD management, chest X-rays and CT scans provide essential information about disease progression in chronic obstructive pulmonary disease, which is COPD. Imaging findings directly inform oxygen therapy requirements in the home settings, pulmonary rehabilitation exercise programs, exacerbation prevention strategies, end of life care planning discussions. The family respiratory support training is important. The imaging nurses use scan image to teach families about optimal positioning for lung expansion, recognition of infection signs requiring urgent attention, breathing techniques for specific anatomical changes, and proper use of home nebulizers and inhalers based on the airway structures. The digital imaging and patient portals, the secure image sharing, the modern nursing systems, especially the NHS in UK trust increasingly provide secure digital access to imaging studies through potential portals, allowing authorized family members to view scans remotely. This accessibility supports informed decision making and family involvement in care planning. The virtual consultation telemedicine platforms enable joint review of imaging findings when multiple family members are present regardless of their location. The electronic health records, they integrate of imaging results with comprehensive electronic health records allows families to track disease progression over time, compare current and previous studies, and prepare informed questions for the healthcare risk. Nurses as educators for imaging technology for families. The educational fundamentals are that the imaging nurses provide structured education about basic principles of different imaging modalities, what specific findings look like and mean, warning signs that should prompt imaging follow-up, preparation requirements for upcoming studies, and the practical aspects of the imaging appointments. Building family confidence through education, the families develop reduced anxiety about technical procedures, improved ability to advocate for appropriate imaging, better understanding of disease mechanisms, enhanced participation in shared decision making, and greater confidence in home care based in imaging insights. Addressing cultural sensitivity, there are religious considerations. Imaging nurses navigate complex religious requirements around modesty, gender matching of healthcare providers, and concerns about radiation or contrast media ingredients, for example, the porcine derived products. Language barrier is also very important. Certified medical interpreters are essential when explaining complex imaging findings with nurses, ensuring that technical terminology is accurately translated and comprehended by families. Then are the cultural beliefs, various cultural perspectives on technology, radiation, and interventional procedures may require tailored approaches, with nurses adapting explanation to align with cultural frameworks. The real world example, family led advocacy, when Michelle's mother insisted on more frequent imaging for his inflammatory bowel disease despite stable symptoms. Our team initially hesitated. Her persistence led to an MRI enterography that detected early stricture formation before clinical manifestation. That was reported in the Clinical Nurse Specialist Royal London Hospital. This case exemplifies how families often develop very initial and very sensitive understandings of disease patterns that complement clinical assessment. The mother's advocacy led to early intervention that prevented emergency surgery and hospitalization. So there were outcome of collaborated approach, early detection of complications, reduced emergency of of the department presentation, decreased hospitalization rates, and improved quality of life through proactive management. The family self-care in imaging-based management observation. The families learn to monitor specific symptoms correlated with previous imaging findings, becoming expert observers of subtle clinical changes. Documentation, the detailed symptom journals help correlate daily experiences with imaging results and creating valuable data for clinical decision making. Then is the communication. The family develop precise language to describe changes based on understanding of anatomical structures seen in the imaging studies and action. Using imaging informed protocols, families make appropriate decisions about when to adjust home care versus seeking medical attention. Reflection, the regular review of imaging results and symptom patterns helps families understand disease patterns and anticipate needs. Psychological benefits of visualizing the progress. The power of visual confirmation is that once a imaging expert or a nursing imaging nurse have seen the findings for many families, imaging chronic illness, seeing tangible evidence of improvement on imaging studies provide powerful psychological benefits. So once they know that there are improvements, this gives them satisfaction. So the validation that difficult treatments and lifestyle changes are worthwhile, concrete evidence to encounter the subjective nature of many symptoms, the visible milestones to celebrate in lengthy treatment journeys, and motivation to maintain challenging medication of therapy regimes. There are challenges explaining negative or complex imaging like the preparation phase, the communication approach, and ongoing support. Barriers to which is access to imaging in the community. So current challenges in UK healthcare are, despite the NHS comprehensive coverage, significant disparities exist in imaging access. The rural communities face travel distance exceeding 50 miles for specialized imaging, wait time for wait time for non-urgent MRI range from 2 to 18 weeks depending on location, and weekend and evening access remains limited in many regions. The equipment distribution favors major urban centers. Nursing solutions, imaging nurses help overcome these barriers through patient navigation services to expedite urgent cases, the coordination of multiple imaging studies during single visits, advocacy for mobile imaging services in underserved areas, and telehealth pre-assessment to reduce field appointments. The training requirements for imaging nurses and family care includes the advanced practice, specialized certification, specialization like the cross training in pediatrics, geriatrics, oncology, and neurology, communication skills for advanced training in breaking difficult news, health literacy, and family dynamics. The technical knowledge, which is the understanding of all imaging modalities, radiation safety, contrast media, and image interpretation basics. Then is the nursing fundamentals, strong foundation in assessment, care planning, patient education, and holistic nursing practice are required. There are some guidelines for evidence-based imaging nurses, and implementation and review of the standards are important. The impact of innovation, new imaging modalities, AI-supported diagnostics are there. The artificial intelligence algorithms now assist in detecting subtle changes in chronic conditions with imaging nurses, helping families understand both the benefits and limitation of AI flag findings. Interventional radiology has come up and is helping a lot. It needs education to the families through the nurses, and then comes the molecular imaging. There is advanced techniques like PET MRI provide metabolic and structural information simultaneously, requiring nurses to explain these conditions, but informative studies to families making treatment decisions. Using imaging to track family-oriented interventions, we can have physiotherapy outcomes. Sequential MRI studies of joint provide visual evidence of how family supported home exercise programs impact disease progress in conditions like rheumatoid arthritis, motivating continued adherence. The nutritional intervention is also important along with the respiratory management. So the global prospective family-based imaging nurses. Elsewhere, we have European Union, where like Denmark and the Netherlands have pioneered family presence during all imaging procedures and dedicated family education spaces within the imaging departments. Their nurse-led programs emphasizes shared decision making. In US, American approaches emphasize consumer choice and technological innovation, with imaging nurses serving as patient navigators in complex healthcare system. Family education focuses heavily on insurance covering and cost consideration. In East Asia, countries like Japan and Singapore integrate traditional family hierarchies into imaging protocols with nursing facilities, multi-generational decisions making, and respect for cultural practices around privacy and disclosure. The research frontiers ongoing studies linkage mapping, family nurses and outcomes. Reduced readmissions are 37%. Patient satisfaction is 84%. There is cost saving of about 2.4K pounds, and treatment adherence is 4.2 times more. So the summary of key takeaways are: family integration is important, imaging centrality. The medical imaging provides essential data that drives treatment decisions, measures progress, and helps families understand abstract disease concepts through visual evidence. The nursing role: imaging nurses serve as interpreter, educate, and safety guardian, bridging the gap between complex technology and family understanding. The future direction is emerging technologies will bring imaging closer to the home settings, requiring new approaches to family education and involvement in increasingly accessible procedures. Thank you for listening. Thank you for inviting me to talk about this very important topic. Thank you very much.